should I go work for DSO Affordable or whatever? I know they'll be like, it's the evil empire, and I'll be like, no, like, it's not that bad. You're
Right.
going to go out and you're going to get your experience. It's okay. And who knows? You might excel in that framework, but even if you only did it for 2 years, it's okay because why? Dental school doesn't prepare you. It doesn't. And so I could have gone private practice, but I went in the Navy. Why? Because, well, one, I had been a prior Marine and I missed the military and I loved it. But two, I thought when I graduate, I don't want to worry about my paycheck. I don't want to be hurrying to do more dentistry and make that money. I'll just take a base pay and just ease into it. And so that's very much, I think, what you were talking about, that
Yes.
DSO mindset,
Yeah.
right?
And for me, I mean, so I went into private practice and I did DSO. For me, it was also a different reason. Like I'm a mother, right, of three boys. And so I found out in private practice, I ended up having four babies, like my three and the practice. And it
Mhm.
was just taking too much. So it helped me focus on learning the skills and not running the business. So everyone has a different reason. For me, I wanted to be more available for my family, and so the private
Right.
practice.
Welcome back to the All In, All On X podcast, where we take you behind the scenes of full arch dentistry, innovation, and the people who are redefining what's possible. Here we go beyond the procedures and into the lives of people shaping full arch dentistry. This isn't just about implants or workflows. It's about the lives we build, the decisions we make under pressure, and the leaders who push this profession forward when no one's watching. Get your head straight, because we're about to go all in. The All In, All In X pod is brought to you by JB Dental Labs, the elite lab trusted by full arch surgeons, prosthodontists, and digital forward practices internationally. JB specializes in precision full arch restorations, zirconia, PMMA, photogrammetry workflows, and fast turnaround times that don't sacrifice quality. JB delivers a truly digital workflow powered by their proprietary online portal for easy case uploads, real-time tracking, and fast streamlined communication. If you're looking for a lab that understands immediate load, passive fit, and the demands of modern all-on-X dentistry, then JB Dental Lab is redefining what a full arch partner can be. Learn more at jbdentallab.com.
Today's guest isn't just placing implants. She's thinking about them differently. From building an implant-focused practice to developing true clinical judgment, she's focused on something most dentists miss. Not just how to do the implants, but how to decide when and the why. Dr. Jumoke, welcome to the show.
Why we got into dentistry, right? Like I didn't even
Yeah.
know I was going to get into dentistry. Like honestly, my dad wanted me to be an accountant. Um,
Okay. Interesting.
I know he's like okay, but I like to make people smile, and so when I got into dentistry, that's what I wanted to do. But I realized very early on that I enjoyed surgeries, and I did not like endo was not my favorite class. Like, so
Hmm.
I knew for sure I was not going to ever be an endodontist, like never. And then, there was talks about maybe you do ortho, because it's great. I was like, I would be bored. Like, I would be so bored just sitting there. So I knew that was gone.
Hmm.
And I just kind of had a natural knack for surgeries, right? And so that was it.
Hmm.
And then I ended up at like affordable dentures, which all you do
Hmm.
is dentures. So I love removables. I was like, okay, this would work. But then I started seeing these patients that were just always angry with their lower dentures, like,
Right.
and, and almost drove me crazy. And that was around the same time that affordable decided to step into implant dentistry. So for
Hmm.
me, I was like, okay, I'm going to try it. I'm going to see if I love it. And of course, I absolutely fell in love with it, not just because of the technical part, but because I could see the difference in those patients, right? They're always the grouchy ones. And people always like denture patients are grouchy. I'm like, if you didn't have teeth and you had to like gum everything, wouldn't you be grouchy? Like, it's just
Yeah.
what happens, right?
That's right. Yeah, and you
Yeah.
gotta give people a little bit of grace. So, what comes in people being grouchy it comes into my mind when you get a new consultation, and sometimes your coordinator or your life I call them lifestyle team members, or people call them salespeople too. But they'll come to you and they'll be like, "Oh, I got somebody here, and they're really not in a good mood, and they're grouchy, and it's kind of like difficult to talk to them, and they're like, and
Yeah.
I always go in and I say, hold on a second, let me just kind of go in, and you got to understand, one, they don't love the dentist. They have high anxiety. They don't want to be there. They probably have bad stories. Two, you know, a lot of dentists have probably heard them or they haven't gotten anywhere, so they might go in with those misconceptions. Three, the depression of having bad smile and bad teeth. So I always go in like, okay, is this a miserable person that I'm not going to like, or is it just somebody who's having a bad day and in a place they don't want to be in? Because we can change that. We can change their attitude. So I'm very
A
much with
hundred
you.
percent. Yeah, like so that for me is a big part of what I like to do in dentistry. Like the hard patients are like they're the reasons why I'm there. Like I want to get to the bottom. Like, and a lot of times we go in there and it's also some of the things that I talk about, like even how we present, like we stand over them, like we're talking
Hmm.
gibberish to them. We're talking gibberish. They don't understand. We're in their mouths and we're searching through. And I mean, everybody is very we're very protective of our personal space. So we're all in their mouth and then we're saying something to the staff and then we come up with a big bill. And it doesn't help. Like, let me not go into insurance and how, they think about insurance, like medical insurance, and they come into the dentist and it's different and they think we're trying to take from them. So it's so many different
Right.
layers that makes that interaction harder. And so
Hmm.
I try to make sure that one, I'm my best self when I show up and that I make it a little more human. So most
Right.
times, actually, when I do my consults, I don't ever start out with what's wrong with their mouths. Like I want to know the person. Like,
Yep.
why did you choose today? Because I've found out also that there's always a reason. Like the bad tooth's been bad for 10 years but something
Right.
made them coming today. And my
Hmm.
goal is always to find out what that one thing is. Because if I can
Right.
find what the pain point is, then we can move forward in finding a solution.
Absolutely. I mean, they show up on the consultation schedule all the time with wants one tooth, missing one front tooth, right?
Yes.
And I always have to caution the people on the phone, not to be so dismissive of them, because it may be that the one tooth in the front is what got them to call, but they've got a full mouth of bad teeth, and you just don't
Yes.
know until you talk to them. And like you said, it's been going on for
100%.
10 years. Yeah.
Yeah.
Did we go to the same school with the same instructors or have the same mama or something like that?
maybe maybe the same mama, a different daddy.
Same mama, different daddy? Why?
Yeah,
Why? Do I look
it
do I
can
look
be.
different?
Yeah. So I mean, no, I mean, no, you don't. We look very similar. I mean,
Same.
don't
I
you
mean,
see
we
the
both have two
resemblance?
eyes. I've got a
We
nose,
have
you
the
got a
same kind
nose.
of eyes, the same
Yeah.
nose, the
Oh, we
same
both have
hair.
eyebrows.
There you
Nice.
go. That part.
Must be must be the same mama, daddy.
Yeah.
Obviously. I feel like I've been friends with you for years already. This
Thank
is
you.
great. You've
Yeah,
got an
it's
infectious
dentistry is
personality.
hard enough, right? Like
Yeah.
we just want to enjoy life. And I think the dentists that do well are the ones that just like you want to help people, but at the end of the day, it's not that serious, right? Like it's a way of living and there's life outside of the operatory. That's what I always say. And I just want to
Yeah.
make sure that I am feeding both parts of my life. Like I'm
Yeah.
feeding my work life and I'm feeding my real my outside of work life, right? Because there is no balance. Like
Right.
I would tell you that work life balance thing is a farce. It doesn't
Hmm.
exist. um
Right.
it's more of a harmony, like how do I feed both of them so that
Right.
I'm showing up on both sides. Yeah.
Yeah. Yeah, I totally agree with you. Going back to a comment you just made about dentistry is hard enough and we need to be nice to each other. I think you just said that.
Yeah.
And why is it? And there are very good dentists who are very nice to each other, but why is it that we all get that when we're talking to patients? Like treat them all kindly and give them grace. Why is it that dentists look at other dentists with such competition and contempt? And oftentimes like think, oh, I could have done better. What's wrong with that dentist over there? Why aren't they trying? Why aren't they any better? Do you know what I'm talking about? You see that people,
Oh my
dentists
God.
looking over each other's shoulders?
Yeah. Or like even like throw each other under the bus when a patient comes in and said, oh, that work wasn't done well. Right. I've
Hmm.
seen it. It's happened to me. And I remember saying, I have a mentor that told me, very early on, and I'm sure you know who he is. And he told me, he's like, don't that like that's the last thing you're going to do, because if you do it in front of a patient, they'll do it, when the patient comes in and they're like, oh my God, that last dentist was horrible. And they start telling you all these things about that dentist.
Right.
Know if you can't satisfy them that they're going to say that's at the very next dentist. Right.
Hmm.
And so for me, when I started my journey in implant dentistry, I was in a small town in Georgia, and I was the only general dentist that was crazy enough to like to place implants. And so immediately I got a lot of flack from so many other dentists, and they were
Right.
very, had me under a microscope, which, at that time felt really bad. But now looking back at it, was actually great, because I felt like I had to go over everything and make sure I was overly competent, because I
Hmm.
knew that other dentist was going to throw me under the bus. And then one day his patient comes in, and then there was something wrong. But one philosophy I've always had is, you know what? Like, I don't know what happened when the patient, dentistry is it's a unique art of medicine where,
Hmm.
the patient's involved in the care. You don't know what happened when the patient went there. I mean, we know a lot of times when patient come to us and they don't tell us the whole story. So I don't
Right.
know the whole story of what happened that day, what kind of day the doctor was having, how the patient presented. So I think it would be too godlike of me, or thinking I'm a god, to
Right.
make a judgment and say,
Right.
well, they did something wrong, because I don't know. So
Yeah.
typically what I would do is, if I see something that kind of looks out of sorts, I typically will get the doctor's name and then call them. And
Hmm.
sometimes you'll get the doctor that's like, "Why are you calling me? I didn't do anything wrong." I'm like, "No, I'm just letting you know because I have this patient in my chair." But I don't know why dentists do that. Like, I've never really understood it, because other arms of medicine I don't necessarily see with my friends that are in other arms of medicine. I don't see them saying that happens, but I see it a lot in dentistry.
Yeah. I mean, there's a case, you're in Georgia. There's something that just hit Facebook, all over Facebook pages in Georgia, about a dentist having his practice shut down and losing his
Yes.
license. And
Yeah.
it appears that a lot of his patients ended up at another doctor's office in town. And this doctor decided to maybe turn this guy in.
Yes.
And the board of dentistry seems to have suspended his license even without a hearing,
Oh,
which, I
yeah.
mean,
The Georgia Board of Dentistry is, they're very,
yeah.
different. Yeah.
I
Yeah.
read the complaint, and I mean, I'm not going to mention anybody by names, but I met the guy, and was a very nice guy. I met him at CE courses, and I've never seen his work, but he seemed to be very conscientious and very
Mhm.
nice. But you read the complaint that this other doctor looked at his work and said, well, in this case, he had vertical dimension was insufficient, at least a millimeter. And something like vertical dimension of occlusion insufficient, at least a millimeter. It's not an exact science at last I checked,
No.
and it's an awful damning, condemning, concept. Anyway, it's just, why are doctors scrutinizing, and why do we have the crosshairs out on each other when they really don't in other professions of medicine? That's something I'll
Ye
never understand.
Yeah, I mean, I think I do see a lot of God complex, though, in dentistry, and that might play into it, right? Everyone
Yeah,
thinks, I mean, because I see other arms of medicine, and they're more collaborative than they are divided,
right.
So, yeah,
Yeah.
couldn't tell you.
Well, safe to say that if their patients ended up in our office, we would probably have the olive branch extend. We'd say, look, it didn't turn out. I wasn't there.
Yeah.
I can do this differently if you want me to. I can do it over, right?
Yeah.
Probably the right way to
And,
be.
I think working in a DSO also helped, like, really helped me with that, because I was in leadership in a DSO for years. And so I
Hmm.
had the opportunity to go in
Yeah.
to other so many practices. We had, 400 practices across the nation. So I had the opportunity to go in and see the works of a lot of doctors. And, I'll see an X-ray or CBCT, and in my mind, I have to tell myself not to prejudge based on what I see, and then I go back and talk to them. And there's most times, I mean, look, there are always going to be bad eggs, right? But
Yeah.
most times, once you get the backstory, like, you understand and you empathize. Like, does it
Right.
make wrong right? No, but like, you begin to understand there's more than two sides to a story, right? And the X-ray doesn't tell the whole story.
No, I completely I mean, there's that whole patient interview and what the patient wants and all the dialogue that goes on chair side that can lead you to a certain decision. And oftentimes patients will lead the doctor into doing things that maybe they didn't otherwise recommend primarily. So, I get it. Can we talk about the DSO? Are you free to chat a little bit about it?
Yeah, sure.
Yeah.
Yeah, yeah.
So, it was with who?
I was with
It
affordable
was with,
dentures and implants, yes.
right. It was with Affordable Dentures, 400 offices you would clinically oversee, clinical advisor,
Yes,
of so to speak. What was your
yes.
title?
Chief clinical officer.
Chief clinical officer.
Yeah.
I was searching for that. I couldn't there was an official term. Tell me about that role in dentistry. How did that what did you learn from that? How did that change your perspective on dentistry from what it was previously 5 years before that?
Oh, yeah. Okay. So, I mean, there's always good. I mean, when you're in a DSO and you're leading. So first of all, I was a clinician with the DSO for years. So I was on and off with Affordable for 20 years. So I knew the network very well. And, we also were very focused on specifics, right? It was dentures, implants, extractions. That was all we did. And so moving on into a management role, I went in as a clinician, 100% clinician, right? Like right is right, wrong is wrong. And
Mhm.
everything is only clinical. Like you had no other perspective. And I quickly learned that it wasn't just only clinical. When you're talking about a DSO, it's also a business, right? And
Mhm.
it's not a not-for-profit business, it's a for-profit business. So
Right.
understanding the dynamics of the financial implications and just also management, right? Like operational management was something that I was good at in my single practice. But now when you had
Mhm.
to multiply it to all these offices and had to have other stakeholders in there, I had to learn to work really nice with other people that may not have clinical insight, right?
Mhm.
But had operational insight. And so that was probably where I had my most growth was like looking at dentistry as truly a business
Right.
because it is. And a
It
lot
is.
of times because of what we talked about before, we went into dentistry just to help people. And we look at it as clinical, but it's both.
Right. Yeah, it's almost a dirty word, right? Business or sales and things. I mean, we are coming to work to earn a living, and we're not exactly taught how to be a business leader. How did you come in to Affordable with any business background at all, or just from what you learned in private practice?
It was just what I learned from private practice, and
Sure.
what I learned from my husband and I ran some businesses together. So, like, what I'd
Yeah.
learned was what I brought in. But
Yeah.
I was way ahead of a lot of doctors in the network because, I mean, in dental school, we had one dental management class. And I remember it was on a Friday morning in your last year, and nobody showed up for that class, right? Now I look
Mhm.
back and I was like, that was probably the most important class, and none of us
Right.
showed up for that class.
Yeah. Yeah, I thought, I mean, it was 20 some years ago, at Michigan, we had a class and it met like once a week for a couple of
Mhm.
years. They were kind of they say on the forefront of doing a little business training. I really very much appreciated that. I thought it was exciting. You would do all these models on like where you
Mhm.
choose to open up and how big your office is and do you invest in this or that, advertising more operatories. And there was a computer program. I thought it was a fun work game. It was like modern Monopoly. So I
Oh,
thought it was
oh,
cool.
really?
Yeah,
Yeah.
yeah. I thought it
Yeah,
was
so
cool. I think they need
we
more of that.
yeah, they do, especially with the newer generation coming out of dental school, right? Like things are so different now with the new graduates, right? I know the doctors that went through dental school around COVID got the short end of the stick, right? Like
Sure. Yeah.
it's been so hard for them to like kind of break out because they didn't get a lot of patient interactions in school, definitely no business interaction. Things are harder now, more expensive. Definitely the DSOs are taking over, and so they have more opportunities there. But then there's always this push for revenue, right?
Mhm.
Production.
Right.
And a lot of times they just don't have a mentor, which
Mhm.
for me was also one of the biggest things. Was I was so blessed to have mentors all throughout, and that
Yeah.
really helped me, shaped really who I am today.
Yeah. So for the new grad in the DSO world, I mean, it's different from where I came out 20 some years ago. It's just DSOs weren't really a big, I don't even think they were a thing really. I mean, there might be
Right.
some group practices, but I don't think there was anything national. I mean, Clear Choice came out later, after I
Yeah.
graduated, and then there was the affordables and the other ones, and there's hundreds and thousands of them now. But it wasn't an issue for me. It was like, you're going to go out, you're going to go into private practice, or you're going to work for the government. I mean, it was basically it. You're going to go to military, public service, or private practice. And now it's, I guess, the majority are looking at DSOs at this point in time. Is that right? Probably
Yeah, it
50% or
is
more.
right. Most new grads will probably, I think the stats are almost 2 to 1 or even more than that, will go to a DSO first. And for
Hmm.
so many other reasons, right? The DSOs probably can offer them a base that is more competitive than a private practice. And most of them are coming out with student loans that are crazy. So they're looking for a place to start immediately,
Hmm.
and when they go into a private practice like yours, they probably it's a lot slower for them, right, to get out of
Yeah,
the mud.
yeah. It would also be a lot harder to start off in a private practice like yours or mine, with this kind of advanced surgical and prosthetics.
Exactly,
Um,
exactly.
what's your advice to them then if they're graduating school? So, what do they say? Hey, Dr. A, I'm thinking about going into a DSO. I also have a couple opportunities in private practice. What should I do?
So that's a trick question.
I'm
First
not
of all,
trying to trick you. I promise. I'm
I
not
know.
trying to
So
trick
no,
you.
no. So first of all, I would say, if you could do a GPR, like a post grad program would be amazing at this point,
Yeah.
right? So that you can
Right.
pick up your speed and you can know a little bit more. Because my thought process is that dental school gives you the permission to
Hmm.
now learn dentistry. Like
Right.
it's not a license that dentistry, because I got out of dental school and I honestly just felt like they gave me permission to now go truly learn. So
Hmm.
they're gonna need to learn. If you're looking at reps, you definitely a DSO would be the place for you because you can
Sure.
get more reps there and you're learning on somebody else's dime, to be honest. You're not going to have that much opportunity in a private practice, because the finances are probably tighter and you've got that
Yeah.
doctor saying, hey, we got to do things and we got to do it right. So I would
Yeah.
still say the DSO space. You just have to really make sure you're aligned in terms of goals with the
Yeah.
DSOs. Because
Yeah.
I had doctors then that would come in there and will come into an affordable, but you don't like surgery. Like you're in the wrong
Yeah.
place, girl. Like you're in the wrong place.
Right.
Yeah.
It wasn't a trick question. I kind of agree with you. So I actually did a DSO, so to speak. I joined the Navy. All right.
Oh
And
yeah. Yeah.
yeah, so probably the world's biggest DSO.
That's the oldest DSO, the
Yeah.
military. Yeah.
But docs ask me, and I think I have the same advice. They say, oh, should I go work for DSO Affordable or whatever? I know they'll be like, it's the evil empire, and I'll be like, no, like, it's not that bad. You're
Mm,
going to go out and you're going to get your experience. It's okay. And who knows, you might excel in that framework, but even if you only did it for 2 years, it's okay because why? Dental school doesn't prepare you. It doesn't. And so I could have gone private practice, but I went in the Navy. Why? Because, well, one, I had been a prior Marine and I missed the military and I loved it. But two, I thought, when I graduate, I don't want to worry about my paycheck. I don't want to be hurrying to do more dentistry and make that money. I'll just take a base pay and just ease into it. And so that's very much, I think, what you were talking about, that
yes.
DSO mindset,
Yeah.
right?
And for me, so I went into private practice and I did DSO. For me, it was also a different reason. Like I'm a mother, right, of 3 boys. And so I found out in private practice, I ended up having 4 babies, like my 3 and the practice. And it
Hmm.
was just taking too much. So it helped me focus on learning the skills and not running the business. So everyone has a different reason. For me, I wanted to be more available for my family, and so the private practice.
This segment is brought to you by JB Dental Lab, your go-to partner for full arch prosthetics, zirconia, PMMA, and digital workflow. With a proprietary portal, in-house designers, and an advanced education center, you will experience reliability, precision, and consistency. Visit jbdentallab.com.
once I got through it, I knew it wasn't going to work for me on the long term. So I sold my practice, went into a DSO. Best decision I made at that moment, for sure.
Right. At that moment, are you free and clear of the DSO now in private practice again?
So I'm free and clear. I'm actually, I just left the DSO almost a year ago. I'm doing some locum work right now and I'm doing a lot of teaching, so that's
Mhm.
kind of where we met. I'm doing some
Right.
teaching. I've started an educational program with my friend, Dr. Fenton. And so it's called
Mhm.
Full Scope Dental. And we're teaching the general dentist how to perform basic dentistry, basic surgical dentistry with excellence. That's our key.
Great.
Excellence.
Let's talk
Yeah.
about that because I met Dr. Fenton as well at the same time I met you.
Yes.
It's called
Full
Full
scope.
Scope
Yes.
Dentistry. Okay.
Yes.
And based out of Atlanta there where you are?
Well, he's in Florida, I'm in Atlanta, so we're
Okay.
yeah.
Do you guys have a clinic or a facility or a classroom?
We have a couple of, facilities that we use. We've got some in Florida. We've
Okay.
got a couple of others. Yeah. We've got
Okay.
one in Arizona as well. So yeah.
All right. I might know one in Virginia Beach too, Virginia, if you want
Oh,
to talk.
thank you. Well, I'll take you up on that.
We'll have to see. I got a great institute with a nice classroom. You'll have to come check it out. By the way, I'll extend the invitation to you. If there's something you
Oh,
see you
thank
want
you.
to
I
come
would
check
love
out,
to.
let
I
me
would
know.
love to. Thank you.
Absolutely. So you're teaching general dentists how to do basic surgery. So single implants or
Yeah.
overdentures? What are we?
Yeah, we're starting from extract and graft, right?
Okay.
Like, you'll
Yeah.
be shocked how many, when I poll my friends, they refer out all the extractions. And, could you keep some of those in-house? And I love surgery, right? You
Hmm.
love surgery.
Right.
And I found out that, just extracting and graft is setting your patients up for success. And
That's right.
so basic extract and graft, single tooth implants, overdenture cases, you know, everyone wants to do the sexy all in X, but there's
Hmm.
so much runway before that, and that you can serve your population really well while you're building your skills. So you're not running and prematurely going into the all in X cases. Because when you see a lot of these failures and complications in all in X cases, to be honest, what I see a lot is doctors that kind of ran in a little too soon and did
Hmm.
not pre plan or kind of take care of the basic things that needed to happen before they did the cases.
Yeah. No, I agree. You talk about being able to build your practice with the simple stuff. I mean, when I was, a general dentist doing a lot of implants in the early years, that's how I grew my practice. It was you don't just take out a tooth, you graft it with a membrane. And then if you do that every day, then 4 months from now, every day you have an implant to put in and you're doing another graft. And then the word gets out you're doing it. And 8 months later, you're doing two a day. And 4 months after that, you have two implants a day to place. And you just compound this, every 4 months cycle of extract and graft. It's like I had a policy, we never extract a tooth without a bone graft.
Yeah, yeah.
I
We
say
don't
never. I
extract
mean,
teeth, we extract and graft teeth. Like, that's what
yeah.
we said. We're like, "We don't extract teeth, we extract and graft teeth."
Yeah. And it's better for the patient too, not just better for the practice. You're not, the patient's getting they're getting an option other than nothing or a partial. So, you take something that gives you revenue of 150, $200 and now it's 750, $1,000, right? And then there's an implant on top of it in 4 months. And you can just see how your practice will grow, almost exponentially. Every 4 months it'll take another bump.
Oh,
Yeah.
yeah, and it's, you're doing that, and, it's all about also explaining the value to the patients because people tell, "Oh my god, my patients won't pay for the bone graft." I'm like, "But did you explain to them? Like, do they
Right.
understand the value?" Because it's not the graft that they're paying for, it's the value it brings with it, and that's so, my patients don't pay for implants because they just love titanium. They're paying for the life that I've been able to express to them would happen after they get it. And so being able to explain that is super important, to the patient. And when you explain it and they understand the value, they'll pay for it.
No, I agree. They need you to guide them to what's the best treatment. And they should because you're the expert, right? You're the dentist, you're the expert.
Yeah.
And for young people out there, I'll tell you, every time I had a patient talk me into doing something I didn't want to do, I regretted it and the patient made me pay for it. So you just do what's right. Do what you know is the best treatment. I am in a position as maybe you are, I don't know, but where I'll give them 3 options, but if it's not the option I wanna do, they can go somewhere else,
Yeah.
you
I
know?
mean, so I have a lot of philosophies that I abide by. One of them is
Okay.
if you do the right thing, the money will come.
That's right. That's right.
So that's always it. Like I will do the right thing by the patient. And I agree with you. Sometimes I give them an option. It is an option, but it's not what I want to do or what I think is best for them. I can send them somewhere else to get it done.
But
But like when you're and I think sometimes, when you feel under pressure, is don't ever feel under pressure because when you feel under pressure, you'll do the wrong thing or you'll do the thing that you haven't committed to. And a lot of times it gets you in trouble and you end up paying way more than what you made from doing that one thing.
that's right.
And
That's
ask
right.
me how I know.
I know. I know how you know. I think we had the same painful lesson. We both had the
Yes.
same paddle, I guess. Yeah,
Yes.
I remember vividly this old man, gentleman, and he wanted me to save a tooth. I wanted to pull it, and I begged him and pleaded to pull it, pull it. He told me, "I'm the patient, you'll save it." And then what, the crown, it doesn't even last, I don't know, a year, 2
Yeah.
years, and he came in so mad. And he's like, "You should have told me." I said, "I did. I told you like 12 times." He said, "You should have told me more. You should have told me harder. I'm not the dentist you are, and you're
Yep.
doing this implant for free now." And I'm like, "Okay. Stop bending over backwards to do stuff that you know is not ideal. You're the doctor, make the decision. If the patient doesn't want to do it, they don't have to do it."
Yeah.
Right?
I mean,
Yeah.
yeah, and it's not worth the headache that it gives not just you, the patient, and your staff as well, right? Your team, right? Like, because you're training them to always compromise.
Right.
We're not saying don't take care of the patient, but you're training your team that you're always going to compromise. So you've got to put the stake in the ground at some point and decide what quality is and what you can do and what you don't want to do. And it helps your team be better support for you on the long run.
Absolutely. Yeah.
Yeah.
I agree. And the team, by the way, if you, like you say, treat people right, and if you do good dentistry, they will support you through thick and thin. They
A
will have your
100%.
back. Yeah.
Yes.
You never have to worry about what they'll say when you walk out the door. Do you ever get referrals from other offices where a dental assistant in another office sent the patient to you?
Yeah.
Yeah.
All the time, all the time.
Yeah.
And I remember when I first started implant dentistry too, I actually placed implants on my team, right? Team members. And they've seen me work. And that's why it's so important. Like, it's not so much as the cases we put on social media that gets all the likes. It's professional integrity is kind
Mhm.
of what I live by. Like, do that work. Like if I cannot do dentistry or I cannot do a case the best way possible, then I don't need to do it. And my team, if they figure that out, right? Like so they'll have their friend from the practice down the road send someone over to me to get the work done. It's always it's the best compliment, when the dental assistants because they know more than you think they know.
Oh, for sure. I mean, I just had my last full arch case, well, a couple ago, it was like Monday. She came to our office because at a local DSO, she didn't have a great vibe with the doctor. And when the doctor left the room, the assistant said, "Hey, you got to go see this Hogan guy." So, that's the guy you got to go see. I
Yeah.
don't even know anybody in that office to my knowledge, but it's wonderful that the word gets out there. But it's a sign to dentists, your staff is watching, and if you don't do the right thing and treat people right, you're in a business slipping out the door. And by the way, that team member might slip out the door too very soon,
Mhm. Yeah. I
right?
mean, they're your biggest cheerleaders.
Hmm.
A lot of times when the patients come in and they meet the front desk or someone and they meet you, they
Yeah.
automatically think they're paying for your Mercedes. Like I've
Right.
had patients tell me that.
Right.
So I give them a treatment plan. I walk out the room. The patient leans over to the assistant and say, "Would you do it? What would you do?" Like
Right.
they trust the assistant more than they do you for some reason. And I'm fine with that. So I take care of my team that much more, right? Like
Yeah.
I make sure they see that I do quality work, not because they're looking, but because it's who I am. But then I also take care of them, right? So they
Right.
are advocates. Like they'll be like, "Oh my God, she's the best doctor to do the work." And,
Hmm.
they can close a treatment plan better than you can with all your degrees, with all the letters behind your name.
Right. And if you have to be the one closing all your treatment plans, then I think you probably have a
There's a
systems
problem.
and a teamwork problem, right?
Correct.
So
Correct.
DSO, coming out of DSO, systems and teams. I mean, I know you've got a book you want to write.
I
Like,
got a couple of books. Yeah.
where does the new business startup entrepreneur need to start with systems? What do they have to do?
Um,
It
hire
might
the
be
right person.
too broad of a question, I guess.
Yeah, yeah.
It's pretty,
Yeah. I mean, hire the right core team would be the first thing, you
yeah,
know. You have to you can't do it all by yourself. That's the first thing. And you've got to hire the right people that are going to be
right,
your core. And you have to learn not to micromanage. Like
right,
that's going to be my blessing to them. Like whoever's starting to practice, please don't micromanage them. If you hire the right person, you hire them because they have the skill. Stop micromanaging them because on that thing they have the skill on, you probably know nothing.
right. Yeah, I can barely turn on my computers in this office, so I know what you mean. Next week, I do my business seminar. It's a 2 day how to 5 10 20 seminar on business of all on four and business of it really is concierge dentistry. It could apply to ortho, but how do you get into that? And it's you said the first system you need is a team. My first lecture is on team and who's in what's roles and what people you need in what roles. And
See?
I think that
We're from the same mother.
I know, right? How is she, by the way? I haven't gotten my
She's
allowance lately. She hasn't
I
been
know, me
calling.
too. Tell her to send my check.
Right. Yeah, say hi to her if you see her before I do.
Yeah.
But all the doctors always come with what marketing company should I use? How much do you spend per arch? What kind of advertising should I be doing? I'm like, we're going to talk about that tomorrow. Like, yeah, there's things we got to get to way before that. Right.
Yeah, and I think we've been programmed also to think marketing is everything.
Right.
And it's if you don't have the core, if you don't have a system in place, and you don't have the core people, you're just throwing your money away on marketing.
Hmm.
Like,
Yeah.
I know marketing has its place, but we put so much on marketing. And that's why you'll see dentists jumping around from one marketing company to the other, because it's also not giving them that immediate satisfaction. Like, it takes a lot more than just marketing and putting your name out there and paying this exorbitant amount of money to get them to put people through the door. What happens when the person walks through the door and and Jane at the front desk is doesn't even know what's going on? Like, you
Right.
just wasted that money.
Yeah. Yeah, I see it all the time. Whenever I get a doctor who's been to one of my business courses or clinical courses, and they say, "I'm just not getting the business. I'm not getting any full arch. Full arch is dead. I haven't had an arch in 3 months. I'm only having one a month. What can I do?" And I mean, even before I do a phone call or go to the office, I know that it's the person on their phone that's answering their phone every time, and they have no systems in place, and they don't have the right person on that phone call. I've never found that to not be true. It's always the people answering the phone. And so you can put 20, 50, $100,000 a month in it. And if you're not answering that phone correctly and you don't have a system in place, you might as well be spending nothing, right?
Yeah, I mean, it's the people, then the processes, right? Like, if you have the wrong person in the wrong seat, you are not going to get the results. And a lot of times, in a lot of these practices, because you've got this turnover rate that is ridiculous now, people just want a warm body. And I said,
Hmm.
there's an opportunity cost to just put in a warm body in that chair because, yes, there's a body there, but like you don't have the right people, your processes are not going to work. So you've got to build the whole system, but you have to start with the people.
Oh yeah, absolutely. Um, I was looking at I'm going to see if I can share your website. So I was going to pull this
Oh,
up.
Lord. Okay.
It's, well, it's got a great looking picture here. Tell me, is this where we can find you?
Yes,
Is
that's
this your
me.
main? Yeah.
Yeah, that's her.
You look fabulous.
Thank you.
Absolutely fabulous there. I love that. That's great font, good warm colors here. Um,
Okay.
where where was I at here? I gotta scroll. So,
There.
oh, great, bright pink. I love it.
There. I'm getting all the points, huh?
Yeah, yeah. It's it makes me kind of wonder. I want to keep on looking, so you get seconds to keep someone's attention online. I think you've
Yes.
done it here. You've got our attention. Tell me what
Awesome.
I can find if I read on. What are we going for here? What can they find here? Consulting, mentorship?
Yes, they're gonna find the consulting, they're gonna find the mentorship, um, and mentorship on in so many different directions, right? So dentistry is one of the lanes I'm in, but just mentorship for women.
Mhm.
I've been able to successfully run practices and thrive both in my clinical life and in my home life. And so that's a challenge a lot of high achieving women have. And so I love to help women like kind of navigate that, especially when you're changing seasons and you're transitioning from, one thing to the other, from, being just a wife to being a mother to from being just a general dentist to wanting more skills. Like, how do I balance it? I don't like to use the word balance, but how do I do it and thrive in all of it? And a lot of it is building systems for yourself. So a lot of what I see in practices is actually a reflection of what I do in my own life too.
Mhm.
How do I build those systems to make me thrive? How do I not micromanage the things that I don't like to do? Like, for example, right? And focus on the things that bring me joy.
That's perfect. People need mentorship for sure. I mean, I would be nowhere if it wasn't for my mentors. I'm sure you have a few,
Oh, yes.
right?
I have a lot.
Yeah.
Yes.
Not
Yeah.
just in dentistry, but coaches in life.
Yes. I mean, and that's the thing. You have to find, we all haven't arrived in every area of our life. So I look at each area of my life and I say, in this area, who's doing better or who can I glean from? And then they become your mentor. So in every area of your life, you should have a mentor. You should have
Mhm.
someone that you're looking up to, but you should also mentor someone else.
Right.
Is kind of what I talk about. I talk about a growth circle, and every human should have like these three groups of people around them: a mentor that can pull them up, someone they're doing life with that can challenge you on the journey, and a mentee, someone you're pouring into. Because think
Mhm.
about it, if you put a glass of water and you never pour the water out, the water gets stale. So if you're not pouring into someone, how are you able to get from other people? So it really does help you. And they always say, like, if you're teaching something, you'll know it much better, right? Like, so there's no better way to know what you know than to teach somebody else, right? So I always try to surround myself with a mentor, a mentee, and people I do life with that kind of keep me engaged and challenge me all the way.
Yeah, do you find that with this generation of people who are just kind of stuck on their devices and stuck on the internet and stuck on YouTube learning that they're struggling a little bit to gain personal relationships and mentors?
They are. They are. Because they think they can find everything on YouTube, and YouTube is amazing. Like, you can find some really cool stuff on YouTube, but there's a part of mentorship that is the human element that you will not find on YouTube.
Right.
That human part that I can call a friend, that call a friend button doesn't exist on YouTube.
Right. Yeah, phone a friend. Like
Yeah.
what is that game show back in the day? Anyway,
Oh, yeah,
uh,
I remember.
I had an associate here a couple of years ago, and he had a friend from dental school, and my associate said, "You got to go to Dr. Hogan's classes for all I'm for." He said, "I don't need to go. I'm learning on YouTube. YouTube is amazing." About 6 months later, he contacted my associate and was asking if I would help him with legal representation on a case he got in trouble with. And it was a case probably never should have been embarked on in the first place. And one thing YouTube can't teach you is life experience from older doctors that are mentors. You just can't, you just can't learn everything online, which, it sounds like a plug for courses. I'm not just plugging my own course. I actually plug everybody's course because I don't think you can learn all on 4 and 2 days.
Yeah.
You probably can't learn it from one person. It's more of like a evolution of a decade probably to
Or
learn.
even
Yeah,
more, right?
I agree.
Yeah, even more, for sure.
You are quickly you are a leader in dentistry. What do you mean? I was about to say you're becoming a leader in dentistry. I mean, you're new to me, but
Yeah.
you've got a big you're pretty popular. When I talked about having you on the pod, people know you. And is it do we just attribute that to affordable, or what does that come from?
Um, I think affordable is part of the story. But I think also my story, I've never been one to sit back and kind of not do things. I've even within affordable, I've always been a pioneer of change. And but I think what's even more important is not just the dentistry; it's just the whole life thing. Like I'm an advocate for female dentists to not just sit back. I remember the first time I got the opportunity to speak. I was in a course and the
Hmm.
doctor was talking about all these implants he was placing and all these surgeries he was doing. And I remember sitting at the back of the class saying, well, you're a guy, your wife's probably home. And, look, I'm telling the whole story. So whoever is offended. And I was like,
Yeah.
man, you're probably, you're at work till 6 o'clock, probably, and your wife is home with the kids. And, I was making all these excuses. And can't remember who said, well, if you're making all those excuses, why don't you get up there? And I was like, oh, okay. And
Yeah.
so I think I've become this picture or, yeah, this picture of what is possible. How can you do it and do it elegantly and do it well, right?
Right.
And I think that's part of the message I carry. Do
Well,
it
you're
well.
certainly
Like,
doing it with elegance. Looking at that website, if
yeah,
I
I
want to
mean,
know who does your
implant
wardrobe.
dentistry is also very male dominated. So I think just because there's not as many females in that field,
Yeah.
has allowed me to probably have a louder voice.
Yeah.
Yeah,
Well, definitely uh, dominated. I would agree with that. And
yeah.
the reasons to why, I mean, we can get into the number. Forward deployed. Digital workflow and business in Phoenix, Arizona. Are you ready for digital workflow and business clarity in one focused program? Join myself and Dr. Chris Barrett at JB Dental Lab in Phoenix, Arizona for Forward Deployed. Digital workflow and business, full arch fundamentals, same day conversion protocols, digital workflow, case presentation, live surgery, and team alignment. Register today. The Atlantic Implant Institute. And who chooses what after dental school and whatnot. But I mean, I fully applaud women like yourself who are jumping up and taking the stage and taking the lead and helping other doctors. And I mean, 400 chief clinical officer for 400 offices is not a small task. I mean, were you ever home?
I was gone a lot. Let's say that. So I was gone a lot. And
Yeah.
so again, that's definitely giving credit to my husband because he held it down at home like really well. And
Right.
again, like speaking about life, I talk about dentistry, but I'm going to talk about life. Having a partner that really trusts and believes in you and allows you to go after your dream, right, is
Mhm.
so important because I would not have done it if he wasn't here.
Oh yeah, and I think boy or girl, husband or wife or
Yeah,
spouse, whatever,
partner. Yeah.
that's always true. My wife, Allie, is fully supportive of my career, and she's my number one cheerleader. And,
Yes.
she's like, go, 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 do this, do this, do this. Now, that being said, we try to get a balance and, spend a lot of time together and really check in when we're home, be home, when we're
Yes.
home, not be at work.
Yes.
Athena was on here a month or so ago, and she said the same thing. Her husband, if she says she's going to go to Guatemala or Virginia Beach, he just like, okay, honey, have a safe trip. What can I do to help?
Yeah.
You know,
Yeah.
so that
So I
goes,
think I think part of success is also the relationships around you, and we don't talk about that a lot in dentistry. But you would find the doctors or people that are doing well, they have a community around them that allows them to show up as their best self, be it a spouse or family member. But there's someone there that is kind of cheering you on and helping you um, lighten the load of what you have to do.
yeah. So you got you listeners out there, young listeners out there, make sure you have a good, strong foundation at home if you want to be successful in your career. Correct?
Correct. Correct.
That's what we're saying here.
Yes.
Go- Going back into dentistry, and that's a very important message, by the way. But going back into dentistry, do you feel that overdentures get talked about enough in this full fixed immediate load, full arch world? Is the public getting served on overdentures?
Now this is my lane. No, I don't think it's getting talked about enough. And I think it sometimes it's presented as the lesser option, and it's not the lesser option. Actually, when you start thinking about the edentulous population in the US or in the world and just the comorbidities that happen, like the patients, like all of that, I don't know why we're not screaming it from the rooftop and saying, look, we need to get these patients, the moment we take the teeth out, we need to get them in an implant appliance, whatever it is, because it's a better quality of life overall.
Right.
Yeah.
Yeah. No, I mean, there's definitely I agree, there's definitely a service for it. I don't know why everybody is completely overlooking it, but it's like if they don't come in with, $50,000, they don't get a seat, right?
100%. But I think it's also the glamorization, if that's a word, of the all in X
It
cases,
is
right?
now.
Yeah, it is now a word.
Yeah.
I think it's that, and people just don't understand it. And because, look, I think when I speak a lot, when I say, hey, how many people love to make dentures? No hands go up. How many people want to do all an X? All hands go up. But what
Mhm.
people are missing is that it all starts with a good fitting denture. I don't care if it's a denture you're making. It's the same principles that you're using. And a lot of people run away from overdentures just because of the denture part of it. So maybe we
Mhm.
need to rename overdentures to something more fun.
Yeah, well, do you have any proposals on that? I'm all ears.
I mean, I'm just thinking, I don't know. We need to come up with it. Brother and sister, we need to come up with a new name that sounds equally as fancy as like the All an X, and maybe people will do it. And,
Yeah.
and, in terms of like doctors that are newer in their journey, it's almost well, I wouldn't say almost impossible. It's very hard to screw up an overdenture.
Well, yeah. I mean, you can. I've seen.
Compared, no, no, let me finish that sentence. Compared to an All an X case.
Right. I would say, maybe what you're going for is that, if you don't do it well, it's a lot more forgiving, okay? Because
Yes.
it's floating and you could take it out and get relief if there's pain or whatever. Yeah. Is,
Yeah, but
is
if
that,
you have
is,
an all on X case and the distal implant fails,
yeah.
you're having a bad day, okay? A bad
Well,
day.
yeah, I mean, let me show you something. It's funny you said that because this is a consultation I just had, and we're going to be, Evan, this is one you got to look at this. You got to look at the screen because when you edit this. Um, Yeah, we've got a case here. All right. And let me go back so I can manipulate this the case for us. But um here we are. You can see this case comes in and the upper, it's a lower all on 4, upper all on 3 at the moment.
Oh,
Okay. And as I look at this, I'm just going, this never I mean, if you're not doing remote anchorage, this shouldn't have even been an option,
I
this
was
kind of
gonna
case.
say, like, there's no like posterior support.
Yeah. And these implants, I mean, I took a look at it, by the way. Let me show you something else. These implants out front are probably at a 75, 80-degree angle to the occlusal plane. Um, so we've got that. Let me go back to my screen. I want to show you. And then we've got these x-rays. Where are they?
And how old is the patient?
About
Oh,
50.
oh, so
Yeah.
they're young.
And so here we go. Um, you got these, can you see these implants?
Mm-hmm.
So we got these short little active implants. They're like 8, 10 millimeters. They're failing. And the the request is, can you put in a couple more implants and then finish the arch? Just add an implant. Can you add
No,
one implant somewhere?
we need to start over in remote anchorage, probably.
Yeah.
Probably
And
quad zygos.
yeah, exactly. It's pterygoid, quad zygos, maybe a couple zygos, maybe an anterior palate to save a quad zygo. But it's definitely a complete remake, a redo. And no, we can't just add 2 pterygoids. I see this all the time. And for that doctor that's under that pressure to make everything an all on 4, it's, did you consider just a denture? Or did you consider referral to my practice to do quad zygos? Why are we using 8 millimeter aggressively tapered implants with very deep, severe coarse threads,
I
10
see those
millimeters
all the
even? Why,
time.
why are we doing that?
I see those all the time. And one of the things I try to teach or try to explain to doctors a lot of times is there are two things. One, no treatment is a valid option,
Right,
and a lot of us don't use it. And two, stop saying, if this was my mother, this is what I would do for her, because this is not your mother. And a lot of times that clouds our judgment because we think the more extensive the treatment, the better. But it has to be the best treatment for that patient at that time, which
right.
means the best treatment could change, but in that moment, that's the best thing for them. And sometimes it means a denture or mean turning the patient away even though they have a bag of money in front of you. And I know it's hard, but sometimes it means turning them away. It means no treatment is the best option. And sometimes it's an overdenture on
Yeah.
two,
Yeah.
because that's all that you can successfully and predictably do for them.
Do you think doctors are feeling more pressure to do this kind of advanced surgical and complex prosthetic work because they're driven by the fame and notoriety or by the pressure to produce, especially if they're working in a group practice or a DSO where they're watching the numbers? What
It's
is it?
both. It's both. I mean, you see it on social media. Like there's that pressure. I have a few younger dentists that I watch on social media, and one will post a case. Would post a case that's pretty impressive, and then you'll see the other one post, and you'll see them just, they getting like likes on these cases. And if they post an overday or a denture case, nobody pays attention to it. So like we're creating this animal, right? Like so
Mhm,
it's become this thing, and they're also marketing their business on social media, so they want to post more of those cases. And I think also on the other side is the financial aspect. If you're working for a doctor or you're working for an organization that has set goals for you, financial goals each month, and they're pushing you, right? Like you don't have autonomy in terms of what you do. You don't have full autonomy. Like they're pushing for you to do more cases. And you're like, man, if I do one $50,000 case, then I've made my goal.
mhm,
And we see a lot of that. We see a lot of those pressures. But with the second group, you also see a lot of um, complications. I worked in a DSO, so I dealt with a lot of those complications where you're like, what in the world made you think this was an ideal case? And the
mhm.
world is so fast right now. Nobody wants to take steps. Nobody wants to crawl and walk before they run. I remember when I started placing implants, it took years before I did my first all in X case. And even that one case, I planned and overplanned, and it took
Right,
months. But now they're out of dental school, and in a year, they're doing all in X cases. I'm like, what in the world is going on? Right?
right.
So
Yeah. So not so
off my
fast, my friend,
soapbox.
right? Slow down a little. I say that every time I say not so fast or slow down a little bit, somebody accuses me of being a gatekeeper and keeping them
And it's
down. And
not that. We're actually
uh,
trying to protect them from themselves, you
right,
know,
protect them, protect the
and then
public. And
protect the patient. Yeah.
I do say this all the time, though. I'm like, I am the furthest thing from a gatekeeper. I am teaching this kind of dentistry, and I'm really not getting compensated. Those of you guys think we're all getting rich out here in education. I think there's three people on this planet that might be making a living at it. The rest of it is just, I feel like it's just taking time away from our families, but we want
Yes.
to I want to give back and I want to give the profession. So I'm not the gatekeeper. I'll tell you
Yeah,
that.
not gatekeeping. But teaching just fulfills a part of me also, just
Yes.
being able to give back. There's just something it does for you. Like you can't quantify it in dollars, you know.
It's like you're giving life. So I've never been able to birth a human, and give life to a human, but you're giving somebody life in their career. To me, it's like that male
It
equivalent.
is.
You're the only said this before, but I'm not sure if I ever heard it somewhere, but I probably never had an original thought. So I'm probably plagiarizing this from somebody, but I can't remember where I heard it. But I've always believed that the only immortality you have on this planet is the way that what you transfer to the next generation, the way you make other people feel.
It's the
Everything else
legacy.
will be gone.
Yeah,
It's your
it's the legacy.
legacy.
Yeah,
Yeah.
sure.
That's the only way that we live forever is through knowledge and emotion, just helping other people. So
Yeah,
I think
I
it's
agree. I agree.
I've basically done the same thing as childbirth.
Similar, similar,
Similar, very similar.
similar.
So I've got one woman to agree with me at least.
Yeah,
She's nodding her head in public.
yeah, not in public. So, Evan, cut that off.
Right. Yeah. Um, where was I anyway with that? All right, listen, green light cases. I heard you talk about green light or knowing when a case is a good case. I don't. I think you're talking more about the physical on that, aren't you?
Yes, like, so everyone's like I teach, or I always say, like, I bucket my cases into like what's a green light case? That's a good to go. Like I know I can do this case. I know if there are complications, I can handle them. those should be the first cases you do in your journey with implant dentistry, right? So that
Hmm.
number 19 that's been missing for a while, but has abundant bone, right? Like it's got 14 millimeters above the IN. That's a green
Hmm.
light case. A premolar is a green light case.
Right.
A central is not a green light case, like
Right.
that's an aesthetic case. Of all an X case, don't do it. A case that requires reach split, all of these things, like, because the more complex it is, all those layers would increase your chances of having a complication. So when I that's how I started. I started slow, and then kind of slowly work my way. But as I see doctors, also just teaching doctors for a while, I found out that if you have failures so much earlier in your journey, you're so afraid, or it traumatizes you and you don't grow as fast. So why don't you
Right.
just start with things that are slam dunks? And the more wins you have under your belt, the more confident you get and the faster you can grow.
Yeah, amen. And I lived that. I tracked my own success way back early in my career. I don't remember how many years or months, whatever I'd practiced, probably years, but I wondered about my own success, and I should have published this, but I never did. But I looked at my first 637 implants I placed, and we all wanted to say we have this 99% success rate, which I was boasting at the time. And was surprised to find a 94% success rate at that time. However,
Pretty good.
I
Pretty good.
jumped into that and I delved into that and I said, okay, let's look at all the failures. And I realized that if I kind of threw out like my first 60 implants where I had a bulk of failures, and then if I threw out the cases that I never should have done in the first place, like the hard, ridge splitting cases, or
Yes.
the cases, we found that was 2005, 6, 7, 8. We weren't testing everybody for diabetes, and we found a lot of failures with diabetics. But if I threw out like my first 50 or so implants and I threw out diabetics that weren't tested and known, and if I threw out those super hard ridge splitting cases, I had a
Mhm.
99.6% success.
See?
And so big, I should have published that. It's a big
You should have
lesson for
published
people.
that, because that is so, like, you're speaking to what I'm saying. Like, if you can just stay in that lane, I always say your lane,
Yeah.
right? And
Yeah.
your lane changes. The more mature you are in what you're doing, the more you can move to the right or to the left, whatever it is.
Yeah.
But you want to have a lot of successes at the front end, right? Because
Right.
it boosts your confidence. It also allows your team to have more confidence in you. And then you can also treatment plan more. Like, I saw it. Like, once I was having cases and they were coming back, and these patients were telling everyone in the little town in Cartersville, like, you should go to her, right? Like,
Hmm.
like, I feel great. I can eat, I can chew. I was getting a lot of referrals from other patients too, because it was good. So, like,
Hmm.
if I had a lot of failures, I didn't want anyone in little town in Cartersville saying, "Oh, she put an implant in there, and I've had problems all this while." Like, it's not a good brand builder.
No, no, it's not. I often say you can fool the public for about 3 years, but after that, I mean, the
It'll come back.
reputation is
It'll,
out.
because it's gonna come back. Yeah,
Yeah,
you're gonna
yeah.
see it for sure.
3 to 5 years and you're done if you don't take care of your work and you don't take care of people,
Yeah,
So
I agree.
you can either do the right thing or you can move every 5 years. It's up to you. I don't know.
Yeah, and moving gets expensive, right?
Yeah, I couldn't imagine starting over. I mean, today I had two consultations from doctors I've never even met that I didn't know that they knew I existed, and that's 20, almost 5 years in one place, I suppose.
That's
You don't
great.
get that in 5 years.
No,
It's
you
very
don't.
hard to get in 5 years, I would say.
I agree. I agree.
So there's a lot of benefits to staying in one spot. So as somebody who's been through the DSO model, and I mean, that's the ultimate scale, right? The $1 billion dental business. All right.
Yes.
I don't know how many billions it is. But so let me ask you this, and this may be a trick question.
Okay.
I'm
All
gonna
right, go
put
for it.
I'm gonna set this up. Okay. Alley-oop. All right. You decide what to do with the ball. Can you scale implant dentistry without losing quality?
Hmm. Yes, you can.
How do we do that?
The question becomes, can you afford it? Because you have to put systems in place, right? And you
Right.
have to, so right before, yeah, so with affordable, I did some work on quality. like quality assessment. Like that in itself is such a heavy lift because you have to be able to do that and you have to have the resources to go out and do that on one end. And on the back end of that, you have to have education available to upskill,
Mhm.
and it becomes a big financial burden. So it can be done theoretically, but can it realistically be done? It's a hard thing because it's such a big financial burden.
I agree. Yeah, it's going to take a lot more effort,
Yeah.
and a lot more collaboration between like-minded, good doctors and
Yes.
teams, right?
Yeah.
I
Yeah.
think, that weakest link is kind of that weakest, you're as strong as your weakest link is very true in a large organization, right?
Oh yeah.
So you can't be a great office if your prosthodontist is suffering or your dentist can't do the pros, but or if your surgeon
Right.
is suffering, but you have a great et cetera.
Yeah.
So that's always an issue. Um, to the credit, I'll tell you, you might be proud to hear this coming from. I still get referrals from inside the big boxes.
Okay.
it's great. I get them from here. They know that it's a little bit outside their scope, and I say to their credit, they're sending cases over that are a little more challenging.
That's
So
great.
it's good to know that they're not just keeping them for the sake of profit.
And you know what I also so one of the things I tell doctors is don't have this mentality that you're going to keep all the cases for yourself, right? Because that's when you get into trouble. I found out that the more cases I did and referred out, the better. It was almost like I was able to like sift through and keep the cases for myself that were slam dunks and then send out the cases typically to a surgeon. I had an oral surgeon then, and when I was not very good at lateral windows, like he'll do those and then he'll send the patient back. So you're not really losing out. Like in the grand scheme of things, you're not losing out, especially if you put the patient's need at the middle. One way or
Mm.
the other, you're getting the patient's needs met, but you're also building your team, like internal and external, your referral team, and you're building your community that would help you along the journey, just long term.
Yeah, amen. You just answered my next question. So I was going to ask how young dentists fastest way for them to learn,
Yeah,
build confidence without hurting people. You just said it. You
yeah.
got to refer the things you don't know until you watched enough, learned enough, and you're more comfortable at getting in there. Probably with a
And
mentor.
then you have to be invested when you refer them. Like sometimes, like take the day and go over there and watch that dentist do the work. Right? Like, don't just refer them like, okay, that's it. Like go there. Like, so there's a lot that goes into the building phase. Once you kind of know it's not easier. It's just you have different other challenges. But at that beginning, like be like education should be important to you. And it doesn't have to be in a classroom. You've got to glean from every source that you have around you. So going down the street to the oral surgeon on the day you're off for like an hour to watch the case or a surgeon to watch the case, you learn so much there.
Right.
And if you have a doctor in your practice that has skills that you want to learn, like honestly, like use those opportunities. They're
Right.
huge.
Yeah. And the antithesis of the whole learning experience can sometimes ring true. I remember in my younger days, early days, I'm still young, by the way, but in my early
I am.
dentistry
I'm
days,
always 21, always
I
21.
I am always 13. Ask my wife, she knows. But when I would go to watch oral surgeons, at first it was, oh, I'd go and watch and I'd see the way they do things. And then if I was I'd go back and I'd go back and I'd go see others. And then eventually I learned, okay, what I'm seeing, I wouldn't do anything any different. And it was a validation that I was, okay, now I know because I would do exactly it the way that they're doing it now. So
Correct.
it sort of reaffirmed my own confidence to go out and try
Yes.
it now. So it was also this validation,
Yeah.
So even if you go there and you don't learn anything, you still learn
You still
something.
learn something.
Yeah. That you
Yeah.
got some, you can do this work, you can move. So after you've been through private practice, DSO, back into private practice, family, kids, a beautiful family, by the way. I didn't
Thank
comment on
you.
your website, but I saw your
Thank
beautiful
you.
family. And you've got all this success. What excites you in the morning about dentistry when you go into work? What do you want to see? What really gets you amped up?
So in dentistry, what really like tickles me right now, I'm always going to be tickled when I'm able to serve a patient and, you know, and change their lives. Like that would always be the ultimate. When I see a patient on the day they come in for their consult, and when they come back later, I don't recognize them because their hair is done, their makeup's done, they have a whole new lease on life.
Right.
That would always be the number one. But what tickles me now also is helping other doctors achieve success. And so
Right.
for me, that's probably the biggest thing. When I get that text message from a doctor that I probably went into their practice to mentor and they send me an x-ray,
Yeah.
or they do something that shows that man, they took something, even if it's one thing from what we talked about and they're implementing it. And you could hear it in their voice, people are excited to be better. That's the one thing I've realized.
Right.
People want to be better. Sometimes they just don't know how to navigate that. That's where you and I are there. Like, we want to share the knowledge. Like, please call me. Like, please
Right.
reach out. And a lot of people are like, well, you're so busy and you're such a. I'm like, actually, most people who are mentors at heart, they want to be bothered. We thrive from it. So one of my mentors in implant dentistry for a long time, Dr. Justin Moody, right? And I remember one time I called him early. He's on the West Coast and it's early and he picks up the phone. I'm like, I'm so sorry. I was going to leave a message. Like, no, like, this is what I love to do. Like, I want to be available to help you. So
Right.
if there's a message for younger dentists, is most of the more skilled dentists that we want to help. Like, so don't be shy. Don't not come, like, come and bother us. Please do.
Yeah. Yeah, I agree. I mean, I got into education for probably 10 reasons, but one of them was just to watch other people grow and blossom and see that my favorite class that I do is my fundamentals class with the people that come in and they're just kind of like a fresh slate and just watching these light bulbs turn on and all the great questions you get. That's my favorite. It's much easier, much more satisfying than one of the classes I'll run next on remote anchorage is when people come in for that advanced skill and they all act like they're already know it all.
Yeah,
Like
yeah,
I
yeah.
don't tell me I already know it all, but I took the class. You know, I'm not saying they're all going to be like that, but it's definitely you've got that people that are what do they say? Wet behind the ears or they're a little
Yes.
green, right? And there's a lot of fun in seeing that and seeing the light bulbs go on, and for sure.
Yeah, because they're like a sponge, right? Like you don't, it's like a blank canvas. You don't have to, most times when you have those classes, there's very little to unlearn. Right? It's kind
Right.
of like when you hire a dental assistant. There's work for this great surgeon, and then, they want to tell you what the surgeon did. Anyway, you know
Right.
what I'm talking about. But like
Right.
when you have
Right.
a new one, you can really mold them to like what you want, and it's so nice. It's really nice.
The overqualified technician.
Yes, that one. Yeah.
You're like, do you just want the 15 blade? Do you want to just you want me
Yeah.
to take a break?
Yeah. Just do it yourself. Just do it.
And they're like, really? Can I get out of my way?
Yeah. Like, no.
No, not gonna do that. Well, have is there anything that we haven't discussed that's near and dear to your heart that I mean, I think you've covered a lot of great
Yeah,
cons I mean, a
no.
lot of
I
good life skill, a lot of positivity here.
Yeah, no, that's it. A lot of people are like, why I think I'm always happy. People are like, you're always happy. I'm like, yeah, you owe yourself that to be always happy, and you need to always like look at your life and look at what's going on and filter out the things that don't make you happy because we all have this one life to live, and I'm not going to live a less than life. And a lot of that comes from my faith. Everything I do is built on a foundation of this faith that I have and also this knowing that I was created for a reason for this time. And so I decide that when I do die, like in 150
Mhm.
years, that I want to die empty, that
Mhm.
I want to do everything that I
Respect.
need to do, and I want to die empty.
Right. Having given it all to everybody
Yes, giving
else.
it
Yeah,
everything. Yes.
perfect. I love it. And a saying that I have that was given to me by grace of God through a patient. And she said to me, you're not doing dentistry, you're doing ministry.
Yeah.
And that really hit me because it was true. Although I didn't have the words, but
Yeah.
giving somebody hope and faith and love sounds a lot like ministry.
It is ministry. Yes.
Yes. And so that's, I mean, I think that's what you're saying.
Hey, JB Dental Lab is the lab that full arch clinicians trust when precision truly matters. JB combines advanced digital workflows, photogrammetry compatibility, expert design teams, and high strength zirconia to deliver prosthetics that fit, function, and last. Their communication is top tier. Their turnaround times are reliable. Quality is the reason that so many high volume, all on X practices partner with JB Labs. Visit jbdentallab.com for reliable quality, full arch support. Tell them that the All In, All on X pod sent you.
As well, you know, that
Yeah.
you can
That's what I'm
touch
saying.
people in a very divine, faithful way.
Yes. Yes. So, yeah. So that's why I'm always happy. Well, I guess I'm always happy, I guess. Yeah.
If
I
it's,
try to be positive.
yeah,
We all have our ups and downs, but overall, I generally try to be positive.
I can see it. I feel it. So where can we find you we saw your website. Where can we find you? Where are we going to see you speaking in the future?
Oh, okay. So I actually have a few speaking. I've been speaking a lot lately at DSO conferences. And overdenture is truly like a passion of mine because if there's one thing I want to do in dentistry is to bring awareness to the fact that it's not a lesser treatment option. It's actually a valid treatment option. You can find me on Instagram most of the time at Dr. Jumoke on all platforms. So on Instagram, Facebook. I just started TikTok, so we'll see how that goes. Um, are you on TikTok?
I'm told I'm on TikTok, but I don't run it. I am on TikTok, but that kid over there in the other corner and a couple other people are running my TikTok.
Yeah, so I just started TikTok. So we'll see how that goes. But I'm typically on Instagram. That's kind of like my stomping ground. And then I'm on LinkedIn a little bit lately. I've been playing around with a little bit more social media. Oh, there I am. See, look at you. You have fast fingers.
Yeah, right. I found you. You were saying I'm
Yeah,
on Instagram. I found you. Beautiful,
yeah.
great pictures.
Thank you.
Love it. Ooh, I like this.
Yes.
Ooh, yeah, very nice. You're definitely into your faith, and I think that's we need that. We need more of that.
Yes. And
Gorgeous.
that's the foundation
I
for
just need to
sure.
know who's your stylist. Like, this is
So this
what
was my
is
50th birthday last year. I turned 50, big 50.
oh oh
Yes.
okay.
So we
I
had like
mean,
an amazing party for our friends and family. Yeah. It was
you
a
have
big
to
deal.
do a lot of arches for that dress.
Oh,
That's crazy.
so I do enjoy fashion. So I have to say that. I
I
enjoy
can
fashion.
tell. Absolutely. It looks like a lesson in fashion in there for sure. There's more. You should be in fashion, not teeth, although I'm sure your teeth and implants are amazing.
Thank
Yeah.
you. Yes.
Well,
Yeah, if I weren't a dentist, I don't know what I would be doing, but it'll be something with fashion or something aesthetics.
yeah. Well, for
Yeah.
anybody out there watching this on YouTube in the fashion world, you just found your next supermodel right there.
There you
So
go.
go take a look. Okay. All right. Save you from this dental world. All
Oh
right.
yeah, please save me, save me.
Save me. Well, that was great. Dr. Jimmicky? Did I say that
Jumoke,
right?
Jumoke
Jimmick.
Adedoyin. You said it right.
Dr. Jimmick. If there's one thing that I took from this conversation with you, it's that this isn't really about implant dentistry. It's not about what like speed or ego or volume. It's more about judgment, living a good, meaningful life, right? Knowing when to treat, how to treat, build systems for your in good teams if you want to have success
Yeah.
at your office. What else? I mean, I think that does that about
Find
summarize?
yeah, find yourself a mentor. Like find
Yeah,
one today. It's really important.
find yourself a mentor. Well, Dr. Jim McKay,
Jumoke
this
Adedoyin.
This was a master class in thinking and life skills for sure. And I want to thank you for joining me. And I want to thank everybody for listening on the web, on YouTube, on your pod app. Please subscribe if you enjoyed this conversation and fire away with questions. And also on Dr. Jumoke's Instagram page. Probably be happy to answer questions.
Yes, thank you so much for having me. This has been amazing. This has been really good. I actually enjoyed the conversation. And now I know I have a brother from another father. So,
That's right. That's right. Well, maybe we'll see each other on Father's Day this year.
yeah, there you go. Yeah,
Okay. All
for sure.
right. Okay.
All right.
If I see the invitation, I'll let you know.
Okay, then.
All right. Have
All
a
right.
wonderful rest of your weekend, okay?
All right, you too. Take care.
Take care. Bye.
Bye.
Hey, if today's conversation resonated with you and you're looking to sharpen not just your technique, but your judgment, your discipline, and your long-term vision, then this is exactly why we built the Atlantic Implant Institute. This is not just some weekend course or module. This is not just some highlight reel. This is not just some collection of disconnected modules. This is the core continuum for education and full arch workflow. It begins with Module 1, Core Bootcamp Fundamentals, where we establish surgical foundations, diagnostic discipline, and repeatable decision-making under real-world pressure. And then it continues with Module 2, Advanced Prosthetics and Full Digital Workflow, where occlusion, vertical dimension, aesthetics, condyles, and execution all converge. And then we have Module 3, which tackles remote anchorage, pterygoids, zygomatics, complex anatomy, taught through biomechanics, planning for predictable outcomes. We also teach FP1 philosophy, not just FP3 solutions. And after the continuum, we have modules in FP1 fixed immediate load and also business, how to 5. This is business, leadership, and operational strategy so that you can build surgically what actually works in practical business. If you're ready to go into full arch dentistry with intention, structure, accountability, and purpose, you can learn more at theatlanticImplantInstitute.com.